Recording from the Sunshine City, St. Petersburg, Florida, overlooking beautiful Tampa Bay, this is the Sonography Lounge, sponsored by Gulfcoast Ultrasound Institute. This podcast is dedicated to medical professionals and patients around the world interested in diagnostic and interventional ultrasound. Our podcast will discuss everything ultrasound, from news, trends, career paths, new technology, and industry updates. Hosted by Lori Green and Trisha Rio of Gulfcoast Ultrasound Institute, they bring over 4 decades of experience in the ultrasound profession and are here to guide you through this journey. Now sit back, relax, and enjoy.
Hello, everybody, and welcome back to the Sonography Lounge. I'm Trisha Rio, and I'm here with my co-host, Lori Green.
Hey, everybody.
And we're very excited about today's episode. It is our 50th episode. Can you believe that?
I know.
That went fast.
Incredible.
Yep. So we've been doing this 50 episodes. You guys have tuned in and joined us. And today is actually also a really special episode because we're going to review all of our 2025 accomplishments and all the things we've done, looking back at our 40th year and just reviewing some of the highlights of our year together. So we're really excited to get started. We're going to talk about, things that we've accomplished, growth that we've had, people we've worked with, and just pay honor to what a great year it's been.
Absolutely. I know, Trisha, this year has flown by. I can't believe that we've had another year go by. And, with every year, we always reflect back on, what we've done, what we've accomplished, who we've had the opportunity to work with. And it's just so exciting to be able to kind of sit here and recap that with you. And so you can see all the great things that we have done in our efforts to help you do what you do better each and every day. And so that's why we're here today, so that we can go over some of those things, like how we help clinicians gain their confidence, sharpen their skills, and their interpretation applications, as well as our sonographers as well. When we say clinicians, we mean everybody. Physicians, sonographers, nurse practitioners, PAs, and so forth. We work with so many wonderful people that help to improve the quality of patient care across the board in a lot of different ways. So our goal here, of course, is to help our clinicians utilize ultrasound to improve their ability to accurately diagnose and treat their patients. And this year was especially meaningful to us as we continue building on more than 40 years of education that we provided here at Gulf Coast. And so, the history of our legacy, that actually started way back in 1985, and it still drives everything that we do today. We have always been in the forefront of technology and bringing to you education that is consistent with current trends. And we continue to do that with our mission and our passion to help others. So we're so excited that you joined us here today.
Yeah. We're always trying to grow and step outside. Yes, we're always trying to grow and be innovative and do new things. As you can see, we have a new podcast space. So the last time you saw us, we were probably in our old space. This is our new space. We also have new offices that we've recently moved into. So if you haven't been to Gulf Coast in a while, it's time to get registered for a course and come join us in 2026. So like Lori mentioned, it is our 40th anniversary coming to a close here. And we've had a lot of fun celebrating that anniversary, really just honoring how much that means to the community as a whole when it comes to ultrasound and all of the things that Lori has built and grown ever since 1985. And I can say that I am honored to be a part of this company and this mission. So I'm really glad to be here. So we are going to talk about some of our highlights this year with our educational programs. We have welcomed learners from all over the country, really all over the world, right? And we just had somebody here. They come from for the point of care class. They came from Asia, I believe, because they were here for our POCUS for cruise ship healthcare. So we really do reach people around the world, and we take that very seriously, and we are honored to do that kind of thing. So we've welcomed them from all over the world for our live hands-on courses, our blended scan workshops, our on-site and private education events, through our registry preparation courses, and our expanding library of on-demand online courses and training videos. In fact, did you know, Lori, that this year alone, we have updated or released new over 80 products this year alone. That's incredible.
That's amazing. Yeah.
kudos to our production team. They're
Absolutely.
amazing.
Yes.
So
We have an
yeah,
amazing team here.
we do. We really do. We've also hosted courses for family, internal, emergency, and critical care medicine, as well as POCUS for EMS and pre-hospital applications and our cruise ship healthcare people. And we've also done courses on MSK, OBGYN, vascular, and echocardiography. Regardless of the specialty application, it's just been inspiring to see so many of our clinicians commit to advancing their ultrasound skills with us. And whether it's been in a packed classroom right here in St. Petersburg, or it's been at the learner's own facility, or even someone learning from home with our on-demand training videos and online courses, the goal was always the same: practical, real-life applications that we know will change patient care and outcomes.
Absolutely. That's our entire mission, right? Is
That's
to
it.
help other people help others. And we do that through providing quality education. And speaking of quality education, this year also reaffirmed our commitment to excellence as an ACCME accredited provider with direct accreditation with commendation.
Yeah.
And that is a huge thing for us. It's really meaningful to us. It's a lot of work. It takes a lot to actually be in compliance with all of the core criteria for ACCME just to get your basic accreditation. But with
Right.
commendation, that gives you 6 years of accreditation versus 4. And there's many other criteria that you have to meet that's pretty rigorous in order to meet that commendation criteria. We're particularly excited because this was our 6th continuous reaccreditation time period that we received commendation. So that's 18 years in a row we have had direct accreditation with commendation. So we're very, very proud of that. It's a lot of hard work. We all have to work together to make sure that we meet those criteria. And so, that recognition isn't just a title. It really reflects the standards we hold ourselves every single day. And whether we're planning a program, we're implementing the program, we're evaluating the program, and how we interact and work with all of our colleagues that attend our programs, utilize our resources. And we make sure that everything that we do is evidence-based content. We work with the leading expert faculty from all over the United States and internationally. And we make sure that our education is designed to truly impact the clinical practice and patient outcomes. That's what it's all about. That's why we all do what we do. We want to make sure that we're providing quality patient care that results with improved patient outcomes. And that is at the cornerstone of everything that we do.
Yeah. It's a really good time to be involved in ultrasound right now.
Yeah.
I mean, it's really just taken off.
Right.
And you're right. The rigorous demands of accreditation with commendation, you have to demonstrate that you have directly impacted patient outcomes. And that's not easy for a medical education company to do. But thanks to our participants, our learners, they report back, they share their feedback with us and how they've gone back and implemented that, which we'll give you some examples of that here in just a little bit. But thank you guys for the constant feedback. It really helps us keep pushing that needle forward and keep making sure we're providing that. And as a accredited provider, that also means that we can offer joint providerships. Why don't you kind of share that with us, Lori?
Yeah. So we're very pleased to be able to, as an accredited provider with commendation, be able to offer a joint providership. And so what this allows us to do is for you, if you're offering continuing medical education, we can help other organizations through our dedicated joint providership program. And through this partnership, we help organizations develop educational activities that meet those rigorous standards by the ACCME while maintaining independence and scientific integrity. And so that's something that a lot of people don't really understand, know about when they're planning a CME activity. But if you want to be able to offer AMA Cat 1 credit, it's really important that you work with an organization like ourselves that has clearly demonstrated that we meet and exceed all of the criteria to ensure your courses also are eligible to be to offer AMA Cat 1 credit. So through that joint providership, we support others in delivering accredited education. And at the same time, that allows us to expand access to CME for clinicians who may not otherwise have it. At the end of the day, it's about making sure learners can trust the education they're receiving and know it's designed to improve patient care. So working with us to help you to provide your plan and implement your education will help you to make sure that you meet those needs of not only the learner, but also be consistent and compliant with ACCME guidelines.
Yeah. And they are rigorous.
Mm.
But like Lori said, we've gone through 18 years of direct accreditation with commendation. So if anybody can walk you through that process, we can.
Right.
That's
and
for
we've
sure.
worked through, we have all of the, we have all of the templates
Yeah.
and documents, and can help you get through that process a lot easier than you could on your own, and a lot more affordable.
Yeah. We're here to support you.
Right.
So. Well, I think it's a good time to kind of pay some gratitude.
Right,
We have a lot to
absolutely.
be thankful as we wrap up this year. Like I said multiple times now, it's our 40th year. And when you reflect back on 40 years of education and commitment and learning, it definitely makes you feel grateful for some of the things and people who are involved with that. So we just want to shout out to not only our participants, we wouldn't be here without you guys. The fact that you entrust us with your education and you're committed to growing your diagnostic ultrasound skills means the world to us. So thank you. We also want to thank our online learners, although you guys can't come join us here in person in wonderful St. Petersburg. If you haven't been here, you should really put it on your bucket list. But we appreciate you getting online and utilizing our resources through our on-demand training videos, online courses, registry review, webinars, all those different things that we offer you to support your education in ultrasound. We also want to thank our medical directors and our advisory board members.
Absolutely.
We cannot do this without them. So special shout out to you guys. You know who you are. We really, really appreciate everything you do for us and how you help us build our quality programs.
Absolutely.
I know it's a big commitment, so thank you. We also want to thank all of our faculty and guest instructors. We have so many. There's
Over
so many.
100.
Over 100.
Well over 100.
Yeah,
Right.
so many experts who come and work with us and help us shape our programs, deliver expert, instruction and content through lectures. So thank you all. We truly appreciate how much you put in to your lectures and your hands-on instruction while you're here.
Mhm.
And then our partners and collaborators. Obviously, it takes a village to do what we do. So we are really appreciative of all the support we get through in-kind support, through collaboration opportunities, working with facilities and healthcare networks. So thank you all for your support this year. It means the world to us. And we also had an opportunity to work beside amazing clinicians, residency programs, healthcare systems, industry partners, all of which had this single goal of advancing ultrasound and improving patient care and outcomes. We have loved connecting with all of you. We have so many different ways that we connect with you guys. One way is through our social media.
Right.
You can find us on all the major platforms. So I think we recently even joined TikTok. So be
Yes.
sure that you join our TikTok because I think our newest member, Tinley, has some really fun content that she's planning for next year. So you're not going to want to miss our fun Gulf Coast dances that I'm hearing we're going to be doing.
Oh, boy.
We also have our exclusive Registry Review Facebook
Yeah.
group, which I personally moderate. This year, we climbed to over 500 members, which is huge. And in that group, I really like getting to know every person personally. They reach out to me with questions. They bounce ideas off of me and each other. They collaborate within the group and talk about things they're either struggling with or things they're trying to improve upon, content that they just don't seem to be getting. And I really love to see that interaction. And then we celebrate our successes together, which is always so much fun. So
Yeah.
I'm really just so lucky to be the moderator of that group. And this is our 5th year doing it.
5th year.
So.
And absolutely, Trisha has done an amazing job in organizing and implementing the Registry Review support group. It's one of a kind. We're the only ones who offer that. And, it's basically a bonus for our learners who are utilizing our resources to prepare for their boards. We have over a 99% satisfaction rating and pass rate. And part of that is being able to interact with Trisha in the Facebook group. And like she said, you get to ask questions. She gives sample mock quizzes for people to work with. And if there's questions, we also bring in some of our faculty that actually teach our registry reviews to help and answer with some of our questions that come through. So it's a very, very good support mechanism for those of you who are preparing to take your boards. And like I said, there's no one else that offers that. So, make sure that if you are preparing for your boards and you're utilizing our resources, that you join that group, because you
Yes.
will see that it makes a huge difference.
Yeah. I invite you to come and play with me in the Facebook group. It's a lot of fun. We've also loved connecting with you guys through our free monthly webinars. Those have been so popular, and I've loved to see people taking advantage of the free educational content. Sometimes they purchase CME if they're in need of CME, but it's more about us giving back to you guys. And we developed that during COVID as a way to give back. And it's just, we've seen how much it has helped support you guys. So we've just kept it going, and we love seeing you in there. So keep registering for those free webinars. Also connecting, with you at live events, at national meetings, society meetings, annual conferences, through our blogs, and through podcasts like this one.
Right.
So thank you guys so much for staying social with us. We really appreciate it. And just know, we are not just a training center. We are a community, and we take that very seriously. So,
Right. Yeah, the ultrasound profession is very tight-knit, and it's really important for us all to work together and help each other out. And so we do appreciate any feedback that you give us regarding our courses, or maybe there's topics that you're interested in that we don't offer. And that's what we're here for, is to help support you through education and learning.
Yeah.
So one of the other most rewarding parts of this year has been hearing directly back from you, as I kind of led right into that.
Yes, I'm so excited about this part.
Our learners are so important to us. I mean, you are the reason that we are here. And so we are very appreciative of all the feedback that we get, because it gives us, not only does it reaffirm that what we're doing is relevant and it's helping you out, but it also gives us, it's very gratifying to know that we really are helping our learners to immediately integrate their skills learned into clinical practice, and that it demonstrates that they have improved their quality of care and patient outcomes. So, we've heard many stories from our sonographers and clinicians who have told us, they've gained more confidence to scan independently, that they're starting to do procedures that they once felt unsure about, using ultrasound guidance rather than landmark techniques. Like I said before, that their skills and integrating ultrasound has demonstrated in their clinical practice that they have improved patient care and outcomes. And also, as Trisha said, we have a very high registry review pass rate. So we hear back from our learners that utilize our resources for registry preparation on how they successfully pass their exams. So we review all of the evaluations. We have a very robust evaluation process, and we make sure that we're looking and listening at everything that you tell us.
Yeah.
And so when you're filling out those evaluations, don't think that they get put away in a
Oh no, we read every one of them.
We read them, and we have, take those comments very, very seriously. Yeah. But I think that one important thing to share with you, because it's always nice to hear exactly how our clinicians integrate the skills learned in clinical practice with specific case examples. Yes. And that's what we really enjoy getting, because it really narrows it down to what we're doing. But so we have a few case scenarios that we want to share with you today on how one memorable email that we received was from a clinician is at our Introduction to Emergency Medicine course that we offered this past February. And this particular email came from an emergency physician who lives in a rural area with very limited resources. And one of the things that he struggles with, and many others do that are in similar areas, that you don't have access to some of the resources you need. And so if there's someone that you think has a critical situation, you oftentimes have to medevac them out. And so you want to make sure that if you're doing that, that you have an accurate diagnosis. And that's really where ultrasound can come in. And so he recounted a few ways in which ultrasound has changed his practice and improved patient care and outcomes in just a few short weeks after coming back home from attending our emergency medicine course. But what you'll notice as I go through some of these scenarios is that it covers a wide variety of applications that, even though he performed them in an emergency setting, these are things that you might see in any other clinical practice,
Yeah.
whether you're family medicine or radiology, cardiology, hospital setting, private practice, urgent care, EMS. There's so many ways in which ultrasound is beneficial to use. So I hope that you'll enjoy these because we certainly appreciated his feedback. So one of the first cases that he had when he returned was a trauma patient that had a positive EFAST or trauma ultrasound exam. And there also was no lung sliding and because of that, then he inserted a 26 French surgical chest tube for the hemopneumothorax. And so that helped him to very quickly diagnose and treat a situation that could be very critical for that patient.
Right.
One of the other things that he was able to do just weeks after returning was to be able to diagnose a clinically significant aortic stenosis, and the patient had LV dysfunction. And this was further confirmed later with a full-blown comprehensive echo during that week. But his focused evaluation of that patient enabled him to be able to make a diagnosis of a situation that was critical for that particular patient. And then even going to the pediatric population, he had a 5-year-old girl with facial swelling and a new diagnosis of gross ascites and a 5-centimeter vertical free fluid pocket interdependent pelvis, which was ultimately diagnosed, the patient with idiopathic nephrotic syndrome. And because of that, she was shipped off to pediatric nephrology and admitted for their services. So it helped in a pediatric application there to get that patient to the appropriate place for immediate attention.
With
so
very minimal delay.
Right.
Yeah.
Another situation that anyone may come across in any setting is your patients that come in for scrotal issues. And so he had a patient with an acutely painful scrotum. Of course, came in at midnight. That's when we get all those situations, right? And he documented bilateral arterial waveforms on pulse wave Doppler in the testes. And because of that, he did not need to get the patient medvac to rule out torsion of the testicle for that. So that would have been a very costly, and for the patient having to get medevaced out, it's, a scary situation. It's time consuming and a lot more cost involved. And instead, because he utilized ultrasound, they were able to diagnose as orchitis, and the patient was able to go home. So huge.
Just huge. There's not enough you can say about that.
I know.
I know everyone listening to this has dealt with a patient like that.
Exactly.
And without a sonographer to call in the middle of the night, you got to rely on ultrasound. And this even for those more urban ERs, rather than calling someone in the middle of the night, especially if you're in the north and it's snowy out and, that's going to cause a significant delay to get a tech in there, you can do it yourself and manage your patient and get them what they need and get them home.
Right. And I think, too, we have a couple more scenarios to outline here for you, but I think that these cases also reinforce to the non-physician, the sonographers. There are some who are concerned a little bit about, with all these physicians learning how to perform ultrasound and use it at the bedside, they're worried about their job, longevity. And it's a completely different thing. But I think that this really reinforces how beneficial bedside or POCUS ultrasound is. And if you're in that situation where you have you're either critically ill or maybe you have a trauma situation, it's so important to be able to go to a facility that actually has the experience to utilize ultrasound so that you can get the diagnosis and get to treatment in a much more timely manner versus waiting for maybe a sonographer to drive in. That might be too late. So these are, really instances that really outline the benefits of utilizing ultrasound for your diagnosis.
Yeah, back to that specific case you just gave us. They say time is testicle.
Right.
Here we go. You put that probe on, you scan, and guess what? You've got that patient an answer and a treatment. So if it is torsed, they're getting sent to where they need to go to get it untorsed.
Right.
So, yeah. So, all the men out there are clapping right now.
I know.
I can.
We put those in just for you. So one of the other things that we see quite frequently, especially in the emergency department and late at night, is for evaluation for deep venous thrombosis.
Yeah.
And, that's a tricky one too. And sometimes, clinicians are a little hesitant to deal with that. But again, if you don't have a sonographer on call or it's going to take a while, it's a good idea to learn how to use that, at least the focus assessment of it. And
Right.
in this case, he had 2 relatively low-risk patients with borderline elevated D-dimers who had negative bilateral 2-point DVT studies at the bedside. And therefore, because of that, they were not empirically anticoagulated over the weekend, and both of whom had negative formal vascular studies the next week during business hours. So again, they were able to quickly assess that relatively low D-dimer and the 2-point focus DVT evaluation was negative, to not have to admit the patient,
Right.
anticoagulate them.
Right.
You could wait a few days,
Yeah.
recheck it
Scan.
during
Yeah.
normal work hours with a formal venous exam and confirm that, they didn't need to have that treatment.
Yeah,
So,
because anticoagulation carries its own risks.
Mhm.
So using point of care ultrasound save those patients from having to be anticoagulated, which who knows what
Right.
other risks that then
right. Other side effects and
Yeah.
complications.
that save them from. So
Yeah, absolutely.
Yeah, this is just so impressive. You have one more,
I
right?
got one more.
It's all the same
yeah,
physician,
I know.
by the way.
Yeah, this is all the same person,
Who
the
came to our
same
course.
physician
Yep.
came to the course. And within a week or two, a couple weeks,
Yep.
these are all the cases he saw. And he was able to immediately implement the skills he learned here
Yep.
to treat his patients. And many of them avoid having to medvac them out or put them through treatment that wasn't really necessary, because he had the skill set and the tools to be able to do that. It's so huge. It just, I
It
never get over how, beneficial ultrasound is. It's
Yeah.
what drives our passion here. So,
Absolutely.
so my last case is that he had a patient come in with acute unilateral vision loss who had a complete posterior vitreous detachment with swirly, sloshy hemorrhage in the vitreous, who was appropriately sent to ophthalmology. So, that's kind of what we're looking for with a vitreous hemorrhage, is that kind of swirly. I think they call that the washing machine.
Yeah, the washing machine sign.
Yeah. But at any rate, so he was able to identify that and therefore refer them to ophthalmology the following day, instead of rushing him 100 miles
100
away
miles.
down the road in the middle of the night, because he was able to see that it wasn't a retinal detachment. And so being able to differentiate vitreous hemorrhage from retinal detachment is huge in what the next steps are in treating that patient.
Yeah.
And so I would rather go home than 100 miles away
Yeah.
and know that I don't have retinal detachment.
Uh-huh.
So awesome.
Huge. Just huge. So thank you so much, the physician who sent us all of those
Right.
amazing
We
cases.
so much
If you're
appreciate it.
listening, I'm sure that you recognize those as your own, and we are so grateful that you shared that feedback with us. And to anybody who has attended a course, if you have feedback to share, we'd love to hear it, because as you can see, it gives us the good vibes and it helps us keep pushing forward and doing what we do. So we really appreciate that. I have a fun case to
I
share.
know you do.
I didn't witness this, but Casey, who goes on our trade shows and goes to society meetings, he witnessed this. So he was at a annual meeting, and I guess one of the attendees started to experience some chest pain. And so somebody asked, does anybody know cardiac ultrasound? And it happened to be that one of our former military course participants was walking by and overheard this and grabbed an ultrasound machine that one of the equipment companies had there and was able to perform a focused assessment where he diagnosed an aortic dissection. And so the attendee was rushed to the emergency room, where I'm sure he underwent a pretty significant procedure and survived. So right there, just because he had that knowledge and he had that skill set, just out and about, not even in his own clinic,
Right.
not at work, was just out and about and happened to be in the right place at the right time and save somebody's life.
Yeah.
With point of care ultrasound. So thanks, Casey, for sharing that story with
Yeah.
us.
Like, it always gives me goosebumps.
Yeah, that one's
And that happens
huge.
more frequently than you know. So, being at an
Yeah.
ultrasound conference. If you get
It makes me want to carry an ultrasound in my pocket.
I know. And there's those handhelds, and
Right.
that can be pretty handy.
It does. It definitely makes me think, okay, so now we're going to need you have to know how to do CPR. You need to have the kit on the wall, right? And now we need a portable handheld ultrasound everywhere.
That's
Like,
right.
they all need to just be part of the standard kit.
I think so. Absolutely. And probably you won't be that long before we see that.
I'm sure, like, you'll have the defibrillator,
Yeah.
and you'll have the point of care ultrasound system
That's right.
hanging on the wall, because
Yeah.
it really does make a huge
Yeah.
difference, as
Yes.
we've just outlined.
Absolutely.
So, moving on, as we look forward to 2026, which is hard to even believe that we are days away from that,
Yep.
and we are closing out 2025, we have some exciting things that we're looking forward to. We have lots and lots of things in the works, and some really fun new and expanded course offerings. In fact, we were just talking about a new course we're going to be doing in the summertime this morning, and we're excited to kick that off. We have more hands-on learning opportunities. We've integrated a lot of scan workshops and tried to really mix up our schedule for you guys to give you plenty of opportunity to come to St. Pete and get your scan on with us right here in our little office that is so innovative, so technologically driven. And with all the support that we get from our equipment companies, we have great equipment for you to work on. It's just such a fun place to come learn how to scan and be part of something innovative and forward thinking. So
Right.
we're really excited about that.
Right.
We have updated online content coming your way. As I said last year, we released over 80 either updated or new educational products. Maybe we can beat that number this year. That'll be our
so.
goal. We'll try to beat that
Yeah.
number.
We have over 400
I know.
self-directed educational resources.
crazy.
So, that's huge. And then to add 80 more,
Yeah.
it is really amazing. That's what we're focused on, is
Yeah.
bringing you the resources you need.
Yep.
Yeah.
And we also are growing our existing educator program. Plus, this year, we kicked off our new residency educator program, both of which provide additional support, resources, and comprehensive competency-driven curriculum. So if you are an educator and you aren't using our educator program, you need to call us, or you need to visit the show notes where Casey's going to link some information for you, and you need to get in that program. It's completely free to join the educator program. So if you're teaching at a diagnostic ultrasound school, you can be part of the educator program. There are no requirements to join. And then there's some stipulations with the residency program, but it is complete turnkey ready curriculum. So I encourage you to go visit the show notes, get that information, and then get on the phone with us so we can help you figure out exactly what you need and what we can do to help you do what you do better. So we're excited about those offerings. And of course, we're just excited about some new and innovative things that we have in the works. We can't tell you yet, but it's coming, that are just going to support you more fully in your ultrasound journey. So stay tuned for those.
Right. Yes, we have several things that we're really excited about bringing to you next year, and they're in the pipeline, and we're very excited about that. So stick with us. Check with our website. Give us a call. Read our emails.
Get social with us, whatever it takes.
Right.
I'm sure there'll be a podcast when we let the cat out of the bag too. So stay tuned for those.
Right.
Yeah.
Absolutely.
But regardless of what we're doing, our mission remains the same. We're going to meet you where you're at, and we're going to deliver you the support that you need to improve your patient care and outcomes.
Absolutely. We've had over 200,000 participants attend our educational programs and utilize our resources. And we value our learners so much. As Trisha said earlier, we're so appreciative of everyone that we work with, and we are here for you. So you just let us know what you need, and we will find a way to help you out with that.
Yeah.
And so before we wrap up, we just want to say thank you to everyone.
Yeah.
As we had said before, everyone that we work with. We have an amazing team here at Gulfcoast. Our philosophy is we are really family oriented. We all here are like a big family, and whenever you come to our courses, you just become part of that family too. And so it's not something where you're at a big, huge conference and you hardly know anybody. We get to know you, and
very intimate,
so that we can help you out. So
We are small, but we are mighty.
that's right. That's what we always say. Small, but we're mighty. So thank you all for trusting Gulfcoast Ultrasound with your education. Thank you for being part of our story. It's been a long journey from 1985 to now, and it's been exciting. We've had so many changes that have occurred throughout the years. Obviously technology has changed exponentially, and with all those changes, we changed too. So you never have to worry about being stagnant when you're working with us because we listen and we respond. And so just thank you for being part of our journey, and thank you for allowing us to be part of your journey as well. So from all of us at Gulf Coast, we wish you continued success. We hope that you have a healthy and successful new year. We're excited, and I'm hoping that you will be excited as well and come see us.
Yes, come join us in St. Pete.
Right.
If you enjoyed this episode, we encourage you to leave a comment. We want you to subscribe so you don't miss any future episodes, and share it with some of your colleagues so that they also can hear how point-of-care ultrasound is paving the pathway for improved patient care and outcomes. If you'd like any more information on anything we discussed today, as I said, Casey's awesome. He always puts lots of links and info and support resources in our show notes. So be sure to check those notes out, and you can go from there. And of course, you can always call us if you'd like to have answers to specific questions, or just want to talk about some of your goals for 2026. And so with that,
And what timing?
and what timing.
So
This is also one of our newest members of the
this
Gulf
is
Coast Ultrasound.
Lola,
Lola.
and she is our office mascot, and she loves all of our learners.
Yes.
And so she had to come right in right now, didn't
Right
she?
now. It was perfect timing.
Good timing.
Yes. Say hi,
So,
Lola.
yes.
Yes. Good girl.
Thank you again for
Yes.
joining us, and happy scanning.
Yeah. Until next time, happy scanning, and we'll see you soon.
Thanks for listening to the Sonography Lounge. Don't forget, if you like this episode, please subscribe and leave us a review on iTunes, Spotify, or wherever you get your podcasts. You can also find us on Instagram at Sonography Lounge and Twitter at SonographyLNG. If you have any questions, comments, or topic suggestions, feel free to send an email to us at sonographylounge@gmail.com. Have a great week, and scan, scan, scan.